This presentation will cover preparing for COVID-19. During this presentation, we will be going over the new recommendations made by the CDC. These new recommendations are meant to ensure your safety and the safety of the residents while you are working at Dayspring. This presentation is about ensuring that you know how to contact the health department for any of the following. 1. If COVID-19 is suspected or confirmed among residents or facility personnel. 2. If a resident develops severe respiratory infection. Or 3. If more than 2 residents or facility personnel develop fever or respiratory symptoms within 72 hours of each other. According to the CDC, assisted living facilities are at a higher risk of COVID-19 spreading and affecting residents. For residents who are older and have an underlying chronic medical condition, if they get infected with SARS-CoV-2, the virus that causes COVID-19, there is an increased risk of serious illness. It is important to recognize that residents with COVID-19 may not report typical symptoms such as fever or respiratory symptoms, and others may not report any symptoms at all. Unrecognized asymptomatic and pre-symptomatic infections have a higher chance of transmitting in an assisted living facility. Because of this, the CDC is recommending that the general public wear a cloth face covering for whenever they leave their home. A cloth face covering is defined as a textile cover that is intended to keep the person wearing one from spreading respiratory secretions when talking, sneezing, or coughing. Cloth face coverings are not PPE, and it is uncertain whether these coverings protect the wearer. There is further guidance on design, use, and maintenance of cloth face coverings available on the CDC website, including a recommendation to wash these coverings frequently. Face masks are PPE and are often referred to as surgical masks. In the assisted living environment, we are required to wear a face mask at all times. FDA-cleared surgical masks are designed to protect against splashes and sprays and are prioritized for use when such exposures are anticipated. Face masks that are not regulated by FDA, such as some procedure masks, which are typically used for isolation purposes, may not provide protection against splashes and sprays. A respirator is a personal protective device that is worn on the face, covers at least the nose and mouth, and is used to reduce the wearer's risk of inhaling hazardous airborne particles, including dust particles and infectious agents, and from gases or vapors. So we'll review now the CDC preparation guidelines for COVID-19. These guidelines will cover how to educate residents, family members, and staff about COVID-19, how to keep COVID-19 from entering the facility, what kind of implementation is recommended for infection prevention and control practices, and how to rapidly identify and properly respond to residents with suspected or confirmed COVID. To comply with the CDC guidelines, we will regularly communicate with staff, residents, and any family members that have been specified by the resident. We will provide information about COVID-19, including information about signs and symptoms and strategies for managing stress and anxiety. We will describe the actions that Dayspring is taking to protect residents and staff, and describe what actions residents and staff can take to protect themselves in the facility, emphasizing the importance of social distancing, hand hygiene, respiratory hygiene, and cough etiquette, and source or spreading control. You will see such informational flyers posted throughout the building. We also will remind residents and visitors that public health authorities have urged older adults to remain home and to limit their interactions with others. We will encourage residents to remain in their rooms as much as possible, to practice social distancing, and not allow outside visitors to the facility. If residents leave their room or are around others, we will encourage them to wear a cloth face covering, regardless of symptoms. If the resident does not have a cloth face cover, a face mask may be used for source control if supplies allow. We will encourage residents, personnel, and visitors to remain vigilant and immediately report fever or symptoms consistent with COVID-19, such as sore throat, new or worsening cough, shortness of breath, and muscle aches. We will ask visitors to inform the facility if they develop fever or any other symptoms consistent with COVID-19 within 14 days of them visiting Dayspring. We have posted signage at all entrances and have left notices for contract service providers to discourage visitors from entering the facility. These signs remind visitors and staff to not enter the building if they have a fever or symptoms of COVID-19. As part of source control efforts, staff should always wear a face mask. If there are shortages of face masks, then we will prioritize those for our staff and then for residents with symptoms of COVID-19 as supply allows. Guidance on extended use and reuse of face masks is available on the CDC website. Please note, cloth face coverings should not be worn instead of a respirator or face mask if more than anti-spreading control is required. All staff are reminded to practice social distancing. That is, remain at least 6 feet apart while in break rooms and common areas, and to cancel non-essential meetings. We will actively screen all visitors and personnel, including essential consultant personnel, for the presence of fever and symptoms of COVID-19 before starting each shift when we enter the building. We will send visitors and personnel home if they are ill or have a fever of 100 degrees Fahrenheit or greater. Ill personnel should be prioritized for testing. So in order to keep COVID-19 from entering the facility, it is important that we ask the residents not to leave the facility except for medically necessary purposes. We have canceled all group field trips. And we should ask that residents who must leave the facility wear their cloth face covering whenever leaving. So we have 3 steps as part of the recommended infection prevention and control practices. Number 1 is providing access to alcohol-based hand sanitizer throughout the facility and to keep sinks stocked with soap and paper towels. If you see that we are running low, please make a note to notify the facility manager or Doug Adkins so that we can ensure that we have the necessary supplies available for staff and residents. Number 2, ensuring adequate cleaning and disinfection supplies are available. Again, if you see a need, please advise Doug and the facility manager. And then finally, providing disposable disinfectant wipes so that commonly used surfaces can be wiped down. Routinely, at least once a day, we should be cleaning and disinfecting surfaces and objects that are frequently touched in common areas. This may include cleaning surfaces and objects not ordinarily cleaned daily. So, for instance, door handles, faucets, toilet handles, light switches, handrails, countertops, chairs, tables, remote controls, and shared electronic equipment such as keyboards. Use regular cleaners according to the directions on the labels. Always follow the manufacturer's instructions for all cleaning and disinfection products. And always work to implement social distancing among residents. Social distancing means people remain at least 6 feet apart to limit potential for transmission. Staff will ensure that all residents have been asked at least daily about fever and symptoms of COVID-19, including sore throat, new or worsening cough, shortness of breath, and muscle aches. Historically, we have been collecting temperature readings daily. Now, the CDC guidelines recommend that in addition to taking residents' temperatures each day, that we also inquire about any symptoms of COVID-19. So now we will take resident temperatures and ask about symptoms. It is important also to inform residents to notify the front office or Doug Adkins if they begin to develop any of these symptoms. If COVID-19 is identified or suspected in a resident, we will immediately isolate the resident in their room and notify the health department. It's important to note that older people with COVID-19 may not show typical symptoms such as fever or respiratory symptoms. Atypical symptoms may include new or worsening fatigue, new dizziness, or diarrhea. Identification of these symptoms should prompt isolation and further evaluation for COVID-19. Encourage all residents to self-isolate if not already doing so. And implement processes to maintain social distancing. Again, social distancing is remaining at least 6 feet apart between all residents and staff. For situations where close contact between any symptomatic or asymptomatic resident cannot be avoided, staff at a minimum should wear eye protection and an N95 or higher level respirator, or a face mask if respirators are not available or if personnel are not fit tested. Please remember, cloth face coverings are not PPE and should not be used when a respirator or face mask is indicated. If staff have direct contact with the resident, they should also wear gloves. If available, gowns are also recommended, but should be prioritized for activities where splashes or sprays are anticipated, or high contact resident care activities that provide opportunities for transfer to pathogens to hands and clothing of staff. Consistent with the guidance for the general public, residents should wear a cloth face covering for source control. Staff are expected to use PPE and should receive training on selection and use of PPE, including competency with putting on and removing PPE in a manner to prevent self-contamination. If we have a resident that is confirmed to have COVID-19, that resident will immediately be transferred to another facility as we are not capable of treating COVID-19. Transport personnel and the receiving facility should be notified about the suspected diagnosis prior to transfer. While awaiting transfer, symptomatic residents should wear a cloth face covering and be separated from others. That is, kept in their room with the door closed. Appropriate PPE should be used by staff when coming in contact with the resident. If residents are transferred to the hospital or another care setting, actively follow up with that facility and resident family members to determine if the resident was known or suspected to have COVID-19. This information will inform the need for contact tracing or implementation of additional IPC recommendations. Thank you for all that you are doing to keep our residents at Dayspring safe.